So what's your good name?
Souaibou Sali,
And where are you from?
Cameroon.
Cameroon.
Yeah.
And this is located in
in East Africa.
East Africa.
Africa.
And where from Cameroon?
In
North.
Garwa, not part.
North part.
Yeah.
And where from north part?
Karma.
Garwa, that's the name of the city.
Garwa.
Yes.
Okay. So what were the problems that you were facing when you first come over here?
Kidney malfunction.
Hmm?
Kidney malfunction. The creatine level was a little bit high. He was supposed to be on to dialysis.
Okay.
Yeah.
So doctors.
Diabetes, eyes problem.
Mhm.
I mean, the whole overall body wasn't well.
Okay. So doctors advised for dialysis at that time?
Yes. Yes.
What they said?
They will have to prepare in the future. Like, it's gonna come anytime soon. Yeah, that's it.
So what was the doctor's reaction when they saw your reports and at the alarming level of the creatinine that was there at that particular time?
He, at the time when the creatinine was high, he was sure that we're gonna be in the under this thing on dialysis. He was 100% sure. Like there's no way out of it. So yeah, then we started searching for this place and then we found it. We came.
Okay. And now, earlier I guess there was a lot of swelling present when he visited us over here for the first time.
Yeah, on the legs.
Yes. The legs were swollen at that time. There wasn't.
Coste.
Yeah.
Coste Marupako.
Boleh makan ni
Yeah,
kita
yeah.
kata.
Earlier
Yes.
it was there, right?
Dia boleh lupa.
He's asking when you came.
Oh.
Yeah, Kawara. It was
Tak,
swelling.
tak sebut.
There was a swelling, right? And right now there is no swelling, right? The swelling had disappeared.
Since I think 2 months.
2 months, no swelling is there. You started up the medication last 2 months back, right?
Yeah.
Since 2 months you're on it. And what are the problems other than this on physical level at the time of visit, first visit?
When he came, he was always tired. He doesn't have appetite. He's just sick overall.
Okay.
So, but now he can do exercise. He's doing yoga. He's walking. He's not tired. He just wants to hang out. So,
Okay,
yeah.
great. That's very great. He's feeling good. He wants to,
He's going home.
he's going home.
Yeah.
Back to Cameroon.
Yeah.
So you visited in Medanta in Gurgaon, right?
Yes.
And you have conducted some reports from here only.
Yeah.
So you can see Mr. Souaibou Sali, and this report is on 21st Jan 2019, and the earlier level of creatinine was quite high. It was about 5.3 when they first visited us. 5.3. They visited us in 10th of November, and this was conducted on 5th November 2018. 5.3, and this was increasing on regular basis. The creatinine level was increasing in each and every report,
Yeah.
right? Earlier,
Yeah.
and now from 5.3 it just came down to 4.5, and then again from 4.5 to 4.2 in the latest report conducted on 21st January 2019. And we can see the phosphorus level was quite high, 4.8, and then it came down and became normal to 4.5. Each and every electrolyte has become normal. Bicarbonate, if you can see, this was little less. Now it has came down and become normal, came up and become normal to the level of about 24. Now we're talking about the blood urea level. This was about 161, very high. The urea levels are very high at that time. It came down to about 83 and then about 64 in the latest report conducted on 21st January 2019. Without dialysis, Mr. Souaibou Sali was advised dialysis at that particular time, and is out of that dialysis protocol right now. And if you see the calcium level is within the range, and potassium level is also 5.2. It was high, it was about 5.4, it has came down to 5.2. Uric acid is within the normal range from 8.6 to 5.8. Sodium is again within normal range, 137. Albumin is also under the normal range. Now if you look at the hemoglobin level, it is also quite good. It is to the ratio of about 11 grams. Hemoglobin is about 11 grams. So there's an improvement in each and every part as far as the reports are concerned and as far as the physical level of the patient is concerned. So Mr. Souaibou is originally from Cameroon, Africa, He came down and to Karma Ayurveda to get the treatment for the kidneys, and there's a massive and a great improvement that he has seen and experienced. And these reports have been conducted at Medanta Hospital, which is quite far up from here, right?
Yeah.
So why do you have choose Medanta Hospital?
Well, it's one of the best hospitals.
One of the best hospitals. Yeah. The reports have been conducted at one of the best hospitals. This is what I meant to say. And the reports are very authentic and very true, and reports speak more than the words. Stop kidney dialysis.
So friends, if you still have any doubts, any queries regarding kidney failure and its treatment, please comment on the box below the video and please share your feedback. Do not forget to like and share this video and subscribe to the YouTube channel Karma Ayurveda.
अगर आप भी किडनी डायलिसिस पर हैं और बचना चाहते हैं इस पेनफुल प्रोसीजर से, तो आप भी डॉक्टर पुनीत धवन से संपर्क कर सकते हैं। हमारा पता है G20 NDM 1 प्लॉट नंबर B234 अपोजिट NIMS, नेताजी सुभाष प्लेस, पीतमपुरा, न्यू दिल्ली 110034। हमारे फोन नंबर्स हैं 09871712050, 011-4264-4274। हमारी ईमेल आईडी है doctor@karmaayurveda.com। अधिक जानकारी के लिए आप हमारी वेबसाइट www.karmaayurveda.in पर लॉग ऑन भी कर सकते हैं।